Hello, my name is Diana Isaacs. I am a clinical pharmacist and also a diabetes care and education specialist at the Cleveland Clinic. And I want to talk to you today a little bit about heart health and specifically one of the classes of medications that's really demonstrated a lot of benefits for heart health. Now, in case you're not aware, the FDA, the Food and Drug Administration, actually requires all new medications for diabetes to show that they are safe and that they would not negatively impact someone's heart health. Now, in doing that, they've actually discovered that lots of medications not only are safe, but actually have benefits. And one of these classes of medications are called GLP-1 receptor agonists. That stands for glucagon-like peptide 1 receptor agonists. I know that's a mouthful, but there's several medications in this class. And actually what this class of medications does, it's really powerful. It's got like a 4-part mechanism. So it actually slows gastric emptying to allow you more time to digest your food and make it so the blood sugar doesn't rise so much after eating. It actually also promotes a sense of fullness, and most people do lose weight on this class of medications. The other thing it does is it causes your pancreas to release more insulin, but it does so in a glucose-dependent way. So what that means is if your blood sugar is high, it will release more insulin. But if your blood sugar is not high, it will not release more insulin. Why that's important is because that means it does not cause low blood sugar when used by itself, meaning when you're not combining it with insulin. And then the other effect it has is it actually suppresses glucagon, which is a hormone that can cause more glucose or blood sugar production. So all in all, it's got these 4 parts. It's very effective at lowering blood sugars and lowering A1C, but also appears to have these great effects on heart health as well. And so I want to show you the different medications in this class so that you're aware and you can see if you're not already taking this class of medications, if perhaps it could be a good option for you. So I'm going to go all the way back in history, and this class of medications first became available in 2005, and it started with a medication called exenatide immediate release. Byetta is the brand name, and you will notice I am holding a pen. It looks a lot like an insulin pen. This is an injectable. Most of the meds in this class, with the exception of one, are injectable medications. So for example, this does require attaching a needle, and it is injected in similar places that a person would give themselves insulin. So that can include the abdomen, at least 2 inches away from the belly button, the back of the upper arm, or the front or the sides of the legs, or the upper buttocks area. Now, this one's really fallen out of favor because it's the oldest. It has to be dosed twice a day, and it has to be taken 1 to 60 minutes before meals. So just a little bit more nuances. Also, this one came out before the FDA requirement about the cardiovascular trials. So we don't actually have any clinical trials about this one regarding the specific cardiovascular or heart outcomes. So we've evolved and we got newer medications, and one of the newer ones, this is not so new now, but it was after Byetta, is Victoza. And Victoza, or liraglutide, is the generic name. This is once a day, and this one does not matter if a person eats or drinks with it. So it's a little bit easier to take. Now this medication also, it's a pen that requires a needle to be attached to it. And it can be dosed up to 1.8 milligrams per day for diabetes. Interestingly, there's also a version of this that's specifically approved for weight management, and that's called Saxenda. And that's also a pen, but it goes up to 3 milligrams per day. Now, I want to let you know some interesting facts about this, because there's actually a lot of clinical trial data really showing the benefits of liraglutide. And because of that, there's actually an FDA-approved indication that it can be used to reduce the risk of major adverse cardiovascular events in adults with type 2 diabetes and established cardiovascular disease. Also, this is one of two drugs, two GLP-1 agonists that are approved in kids. It's approved for type 2 diabetes in kids ages 10 and over. So that's kind of neat to know. Next one that I want to talk about is Bydureon, and that is exenatide extended release. And before I show you kind of the updated one that we have, I have to take a second to show you the old version. Nobody has this anymore. I don't know how well you can see, but there's actually a vial, and then there's a syringe that you have to draw up what's in the vial and give it. This reminds me of like the old glucagon emergency kits, but when this came out, it was revolutionary because it was the first weekly GLP-1 agonist. And in fact, we still have Bydureon, but now it's in a much easier to use pen called BCECS. So here I have the BCECS, and you can see this is a lot simpler, easier to use. To use this one, you simply unlock the device. So I go ahead, I turn it, I unlock it, I take off the orange cap, and then I would go ahead and inject it in the desired location. I should have mentioned before you use it, you are supposed to shake it for 15 seconds, but then you go ahead and you administer it. And it's only once a week, which is so nice. Now, something to know is the exenatide extended release, or Bydureon, does not have an official FDA indication for people with cardiovascular disease. And that's just because the clinical trials showed it didn't quite meet the statistical significance to say that it reduces the risk. It's definitely safe. It just didn't meet that threshold. Now, the next one I want to show you is Trulicity, or dulaglutide is the generic. And you'll notice this is also a pen. It's a one-time use, once a week, doesn't matter with food, without food, and a very similar concept where there's a place to unlock the device. So I can go ahead, I can unlock it, this part comes off, and then I would go ahead and, you know, I should get out one of my little pillow things so you could actually see me doing it. But you'd go ahead, put it in, and then you want to hold it there until you hear the second click. So very, very easy to use. Now, dulaglutide, actually, its data was very, very favorable. And so it did actually get some FDA approved indications. And that includes that it can reduce the risk of major adverse cardiovascular events in adults with type 2 diabetes and established cardiovascular disease, or just even having multiple cardiovascular disease risk factors, such as having a family history of a relative that has had an early heart attack or a stroke. So that's something to definitely keep in mind. Now, another one of our other weekly agents, I know there's so many, right, is semaglutide, or Ozempic. And this is also weekly. You will notice that this is a pen. So this is a multi-use pen. Typically, you know, depending on the starting dose someone's on, the pen often will last for 4 weeks. And so you dial it to the corresponding dose, you attach a needle, and just once a week dose with this. Now, Ozempic also has FDA approved indications, and that includes that it can be used to reduce the risk of major adverse cardiovascular events in adults with type 2 diabetes and established cardiovascular disease. So just like we have with liraglutide or Victoza. Now, there is a version of semaglutide that's actually oral. It's called Rybelsus. It's dosed a little bit differently. It's actually taken every day. It needs to be taken 30 minutes before eating anything else, eating or drinking or taking any other medications. And it can be taken with up to 4 ounces of water. So that's kind of nice that there is an oral option for people that just are not into the whole injectable thing. And because it's a newer medication, we're still waiting on the clinical trial data to get that additional cardiovascular indication from the FDA. Now, there's also a high dose of semaglutide at 2.4 milligrams, and that is approved specifically for weight management. It's called Wegovy, and it actually comes in a different kind of pen. This is a one-time use pen, so it's a little bit different than how the Ozempic comes. And this is approved for people with or without diabetes, just like the Saxenda is also approved for people with or without diabetes. So pretty cool stuff. Now, one other thing I wanted to mention there are two actually GLP-1 agonists that are combined with insulin in one injection. So for those with type 2 diabetes that are already taking insulin, adding a GLP-1 agonist can be really, really great and can help actually manage mealtime blood sugars, as well as, again, being able to potentially reduce the cardiovascular risk, improve those heart outcomes. So the two that we have, there is Zoltify, and this is a combination of insulin degludec or Tresiba with liraglutide, not Victoza. And so it's all in one. The maximum is 50 units of the degludec or the Tresiba component, and that matches with 1.8 milligrams of the liraglutide or Victoza element. So you are kind of bound. It is a combination, so you have to, deal with the fact that if you only need 30 units of insulin, you're going to get a little bit less of the liraglutide. But it is a nice option to have one injection instead of multiple injections. And the other thing is, if you have, copays for your medications, it's nice. Usually it'll be cheaper to have one product versus two products. It's also available in one other, and that is called Soliqua. And Soliqua has the insulin glargine, also commonly referred to as Lantus. And it has a GLP-1 agonist that we haven't talked about yet. It's called lixisenatide. You don't usually see lixisenatide prescribed by itself. Usually it's just with this product called Soliqua. And this goes up to 60 units per day. And it actually, that corresponds to 20 micrograms of the lixisenatide. Now, one difference is this does need to be taken in the morning within 60 minutes of having that first meal, versus the other one, the Zoltify, it does not matter the time of the day. And again, attaching that needle just like a regular insulin pen. So I know I've gone through a lot of information, a lot of different products, but what I want to really demonstrate is that we have this amazing class of medications that really can improve your blood sugars. It can help with weight, and it also can have very positive benefits on your heart. So I encourage you, if you have type 2 diabetes, to talk with your healthcare team, if you're not already on one of these agents, to see if you may possibly be a candidate for it. The guidelines from the American Diabetes Association are now recommending, even if someone's blood sugars are already at target, if they have cardiovascular disease and they're very high risk, that they should still be on one of these medications, even if blood sugars are already at goal. So I encourage you to look into it, and also just keep in mind, each one's a little bit different. And so some products may work better. You may prefer an oral, you might prefer a weekly, you might like the way one pen works over another. So I encourage you to know your options so you can make an informed choice about what will work best for you. Thanks so much for listening.